Okay, hello. Today I'm conducting an interview for the Chronic Pain Project on behalf of Jana Gardesi, and I'm here with our wonderful school nurse.
Michelle Krause.
And just to start off, would you like to talk about your experience with chronic pain as a nurse?
Sure. So chronic pain is definitely something that nurses deal with frequently.
Yeah.
It is, something that affects a lot of people, and knowing how to manage and deal with it and cope with it so that way it doesn't affect your everyday life, or if it affects how you function, being able to find other ways to adapt to that is really key for nurses to be able to assist patients.
Yeah, that's an amazing response. Thank you. What kinds of chronic pain conditions do you see the most frequently as a nurse?
So, as a school nurse, we see chronic pain conditions such as lots of kids get migraines, post concussive syndrome, also things, back pain if they have sciatica or scoliosis that can affect them. We also have students who may have chronic conditions such as cancer or a condition that is similar to fibromyalgia. It's called AMPS, but it affects pediatric patients. So there's lots of different conditions that we see for chronic pain in pediatrics.
Okay, thank you. And how do you usually identify when a student's pain might be chronic rather than acute?
We assess the pain. What kind of pain is it? How long has the pain been there? What are some precipitating factors? Things that aggravate it, if it gets better, if it doesn't get better. And so chronic pain is something that occurs all the time, long term. An acute would be an acute injury, something that's temporary, something that resolves, something that gets better. So being able to assess what the situation is and what type of pain it is vital in how you treat it.
Okay, thank you. And how do you balance validating their pain while still encouraging attendance and participation in class?
Yeah, so a lot of times when people are in pain, they don't want to do anything, and it's really hard to be motivated to do something. So we communicate with families, teachers, students, make accommodations, whether it's a 504 plan to help them with accommodations that if their pain is affecting their school day, or rest in the nurse's office, really just trying to help them manage and cope to be able to get through the day and get their education.
Yeah, thank you. And how do you communicate with teachers or administrators about a student's pain management needs?
We ask for parent permission and student permission to communicate with teachers and administration for what the student needs. With those permissions, we're allowed to speak to teachers and let them know, if a student has chronic back pain and they can't sit for long periods of time, to allow them to stand in the back of the class. So as long as we have permission from the student and the parent, we can communicate their needs to the rest of the school staff that works directly with them while maintaining their privacy and dignity at the same time.
Okay, thank you. And what are some common misconceptions about chronic pain that you have noticed among students and staff in school?
That they're faking it.
That they're faking it?
Yeah. If you can't, if you see somebody on crutches or with a broken arm or something, they're pain. You think that they might be in pain, and you can validate it because you can see it. A lot of times chronic pain, you can't see what the injury is. You don't know what it is. You don't, it's not a visible, obvious sign. So some people might not believe them or may not understand it. And so it's kind of our job to advocate for the students and say, no, this is real. They are truly feeling this. So I think that that's kind of one of the misconceptions is that people who can't see an injury don't understand that there might be something internal happening.
Definitely. And what kind of strategies or interventions have been most effective for helping students manage pain at school?
I think mostly communication, emotional support, mental health support, of that it's okay that they're
Yeah.
having these issues and it's okay that they might need some accommodations. Some students struggle with that because they just want to be regular with no issues, and so they have a hard time accepting the accommodations, or they think that they might stand out. So the mental health piece really goes hand in hand with helping them deal with their physical issues too.
Okay. And are there any accommodations or adjustments that schools often overlook but would make a big difference here?
I'm not sure. I have worked in other, not necessarily schools, but in other places where I could definitely come up with a big, huge long list. But I think here at Shrewsbury High, we do a really good job partnering with students, family, staff to get students what they need.
I agree.
Yeah.
And how has working with students with chronic pain influenced your view of healthcare in education?
It's made me want to continue to be a school nurse and help students and help them manage and show them that they can lead successful, productive lives into adulthood. Especially, I really enjoy working with the high schoolers and learning different ways to cope and manage and help treat them. So it's just kind of, for me personally, encouraged me to continue in this role, in this nursing position that I'm in now.
And last but not least, if you could design an ideal support system for these students, what would it include?
Ideally, being able to communicate all the time with outside providers, being able to give the students what they need. I think our 504 program is really great because it does offer the accommodations that are specific to each student's needs. It's not like a generalized plan. I think just continuing to do those things.
And that concludes the interview. Thank you so much.
Oh, you're welcome. Thank you so much.
Thank you.